Hi there, welcome to my channel again. I'm Rosie, and today I wanted to talk to you about the relationship between the uterus and pelvis alignment and why it's so important if you're suffering from menstrual problems, fertility issues, or you're pregnant, you're wanting to get your baby into an optimal position and you're struggling to get it to get there or to stay there. So first of all, I wanted to explain about, I'll just explain that this is a uterus that is carrying a full-term baby, so don't get panicky. um, it's just the size that I've got. And as you can see, it's got ligaments that attach from the top to the front of the pelvis, these two grey ones. You've got these blue ones which attach all around the base of the uterus, and they attach down through the pelvis and in onto the to the labia in the front of the vagina. You've got two ligaments that attach to the sacrum, these purple ones here. And then you've got a broad sheet of ligament that attaches the uterus to both sides of the pelvis and the pelvic floor. So you can see from that that the alignment of the pelvis will have a huge impact on the ligaments and how they pull on your uterus. So if you're suffering from, let's have a look at menstrual issues first of all. Just bearing in mind that from the pelvis, you have muscles that join onto the lower back and right up to um, the, the lower thoracic um, um, vertebrae, and you also have um, muscles that come across the front of the pelvis and join here onto the femur. And then you've got muscles that obviously are joining from the femur right down to the lower leg. So you can see that, and you've also got muscles at the front that join to the pelvis. So what you can see from that is that whatever's happening above or below the pelvis has a direct influence on the pelvis itself, and also then on the organs within the pelvis. So with period pain, if you have got tight ligaments that stop the even and regular pulsing of the uterine muscles in order to expel the lining, it's going to cause you, the cramps and the other issues that you have with period pain. And you can also see how if that's a misaligned pelvis, it's also going to cause that chronic um, um, or that acute lower back pain that's also so prevalent with period pain. Interesting, one of the symptoms I get is knee pain, and that is linked to excessive tightness of my quads. So I do a lot of quad stretching in order to help relieve any discomfort if I do have that when I'm got periods. So, there's lots of exercises that you can do and things that you can do in order to um, um, realign the pelvis and then help the uterus to um, to be aligned as well. Um, for fertility issues, obviously if you've got tight ligaments and they're not allowing the uterus to sit where it needs to, then you've got issues with circulation and also excretion of waste. And that's something that's really important if you are trying to get pregnant. Then you need to make sure that you've got the optimum circulation and waste excretion from the from your uterus to enable an egg to come down and be able to attach to the wall. During pregnancy, if you have a baby that's not in the optimal position, um, it can sound quite scary, especially if it's your first baby. Your baby's not in the right position to be born. What does that mean? Oh, you can have an external version, a cephalic version, and what that does is you have an injection to relax all the muscles in your abdomen and your uterus, and then a doctor will manually turn your baby. Now, they're not always successful. Sometimes, quite often, you'll find the baby turns back to its original position. And what's happening is, if you've got tightness and tension in your womb, it's not comfortable for your baby to stay in that other position. And it might be that it's even too difficult for them to move. Imagine if you were laying in a bed and you had a sheet over the top of you, the sheet tucked in one side and someone sitting on the other side, and you tried to turn. It would be really, really difficult with that tight sheet over you. And that's the same as having a tight, tense ligaments and uterus and muscles all around you. As soon as someone loosens off that sheet, then you can easily turn over. So that's quite often what happens when you have chiropractic adjustments, is that those muscles are able to relax to allow your baby to move, and you then need to be able to work on the alignment so that your baby can comfortably stay in that position. So I hope that shows you a little bit about how to why your pelvic alignment is so important for all those processes of the uterus. You can find videos on the channel for those various things to get your pelvis in alignment, and good exercises to do. So have a look at those, and I'll speak to you again soon. All right, bye bye.